Hi guys, today I'm going to be talking about some important things about what happens after you leave the hospital with your newborn and just common questions we get as pediatricians. So I recently had a new baby, so I went through all this myself and just was going to go over some things to look for. So when you leave the hospital, well, first off, all the physicians and nurses are super helpful. So, if you have questions, they're happy to answer them. Going home, one common question we get is how often to feed my baby. So we'll direct you more specifically for your baby if there's anything that you need to do. But usually, rule of thumb is I say to feed every 2 to 3 hours at least, sometimes more. So until your baby gets back to their birth weight, which usually isn't until 2 weeks, we say still wake up your baby every 2 to 3 hours, even if they're sleeping. After about 2 weeks, when they're back to birth weight, your pediatrician can help direct you, but usually they're okay to sleep a little bit longer if they'll give you that time. Another question we ask is there any vitamin or anything I should be giving to my newborn? So whether you're breastfeeding or formula feeding, we recommend a vitamin D supplement, typically 400 units a day. It's once a day, it goes in their mouth. It doesn't matter if it's morning or night, but you'll give that to them as well. Another question we get is how to deal with the umbilical cord. So, at first they're kind of gooey and then they dry up. And so one question is how to take care of it. And I actually tell families that less is more. So you really don't need to rub anything on it. You don't need to do it. Just kind of keep it clean. And then it usually falls off around 2 weeks. Until the cord falls off, you don't do a bath or anything. You can kind of just a little sponge bath or wipe off any dirty parts. Another common question we get is how often should my newborn be going to the bathroom? So usually we say 1 wet diaper or potty diaper per day of life. So in the first 24 hours, if the baby goes potty, we count that as a win. 2 on day 2, 3 on day 3, and then 4 on day 4. And they kind of take off after that. If you have concerns about the number of wet diapers the baby's having, you can always feel free to call the pediatrician. And actually the Iowa Clinic has an after hours line that a nurse is always available with a physician on backup. So we're happy to deal with those calls at 2 in the morning when you have them. Another question that we get is about how many poops a day. So again, newborn poops are kind of interesting. They're very colorful. So they usually start out kind of this black, tarry, sticky, called meconium. And then as they eat more, it kind of turns into a lighter brown and then yellow poops. And again, usually if they're pooping, it means they're eating well and gaining weight. So newborns sleep a lot in the first few weeks. So another common question we get is how to keep them safe while they're sleeping. So the American Academy of Pediatrics actually recommends sharing a room with your baby up until the first 6 months. So that could be a bassinet or crib in the room, but not the same bed. So the baby should be sleeping in a separate flat place with a fitted sheet, and then no toys, bumpers, stuffed animals in the crib. Another thing is they tend to sleep a lot, so they may only be up about 30 to 45 minutes at a time, and so a lot of it is you wake them up, you change a diaper, you feed, play, and they go back to sleep, and that's pretty normal. Another common question we get is about newborn breathing and what's normal. So newborns do breathe faster than we do as adults, and it can be 30 to 60 times a minute. Again, not something you need to remember. There's always our after hours line. If you just call the clinic, they'll put you on through to a pediatric nurse with one of our physicians as backup, and we can help count breaths or talk about what's normal. Abnormal would be if the newborn ever looked blue around the mouth or cyanosis. That would be a reason to take the baby in, or if you thought they were distressed or sucking in or working hard to breathe. But again, this is nothing you have to figure out on your own. We're always available and we're just a phone call away. As a pediatrician, my approach is to make you feel as if I'm on your side and empowered. I am fairly laid back and open to any questions or concerns, and I always want to hear what you're worried about and work with you as a team to figure out a way to try to make things better.